Hello, everyone. Thank you for checking out the last not podcast, I'm sorry, recording about PTSD and its effects on family members and the veterans as a whole. Um, Today, we're going to continue our conversation about the background information on PTSD. I just want to say that a lot of the information that we speak on today is from the Department of Veterans Affairs, and it's about support and family education and support for the veterans. So today we're going to continue our conversation, like I said, about PTSD. And next week we will touch more on the basis of PTSD and the relationships and families and the effects that it has. Um, so community-based research so far has revealed a lifetime of prevalence of PTSD in the United States today to be approximately 7 to 8%, and it affects about 7.7 million American adults. And this was taken from Kessler, Child, Dimmler, and Walters in 2005. Although not formerly labeled PTSD until recently, the symptoms have been recorded throughout history, such as biblical accounts described PTSD symptoms in Job and Joseph and David. Egyptian, Greek, and Roman mythology refer to similar symptoms. Shakespeare describes nightmares and intrusive thoughts in Henry IV. In World War I, the phenomenon was called shell shock or soldier's heart. In World War II, symptoms were called combat neurosis or operational fatigue. The formal diagnosis of PTSD first emerged in 1980 in the American Psychology Association's Diagnostic and Statistical Manual of Mental Disorders. Research with service members returning from the global war on terrorism indicates that 15 to 17% meet the criteria of major depression, PTSD, or generalized anxiety disorder shortly after homecoming. I do know that my husband was diagnosed. He wasn't diagnosed with PTSD until quite a few years after he had left the military. He was, the evidence of PTSD was there. However, he didn't realize that's what he was dealing with at the time. And it usually appears, like it says, shortly after coming home, returning home from combat. A prospective study of troops deployed to Iraq and Afghanistan found a threefold increase in new onset PTSD among military personnel who had been deployed and who had been exposed to combat, highlighting the importance of the actual exposure to combat rather than simply deployment itself and affecting subsequent mental health. So obviously, being deployed doesn't mean that everyone that was deployed will be affected with PTSD. What usually happens is exposure to combat during deployment causes some problems with mental health. This is where PTSD comes into play. A related study found that rates of PTSD symptoms, depression, and anger problems were 2 to 5 times higher 4 months after returning home. And this was taken by Blythe, Wright, Adler, Thomas, and Hodge in 2007. Future research will examine the course of emotional problems among these service members over time. It is hoped that early identification and intervention may prevent the development of long-term problems for many of these men and women. A lot of times, this is what leads to a lot of the suicide rate among our veterans, is the fact that they are not addressing the issue. And the longer the issue lasts, the worse off the person can get, which then a lot of them, like I said, it leads to suicidal thoughts in most of these men and women. It is so important for them to get the therapy needed. And if you can encourage it in any way, please do. And I think I mentioned in the last one, the way I influenced my husband to get his was stating that he served his country and it was now time for his country to serve him. He started going to the VA. The VA started diagnosing him with severe depression, and which ultimately led to him getting therapy, which ultimately led to them diagnosing him with PTSD, and then leading to getting 100% disability and benefits from the VA. And they all deserve it, truthfully. In general, most people who are exposed to a traumatic event experience some PTSD symptoms following the event, but the symptoms generally decrease over time, eventually disappear. Approximately 8% of men and 20% of women go on to develop PTSD. For both men and women, rape is the most common trigger for PTSD, and that is from the National Center for PTSD. And that is, of course, outside of our military veterans who have been in combat. Although symptoms of PTSD usually emerge within 3 months of the trauma, some individuals have delayed onset. Some avoid facing the painful emotional residue from the trauma for many years, often using substance abuse or other addictive behaviors to distract themselves from the feelings. When the individual begins to exhibit symptoms of PTSD many years after the event, families may feel confused. So sometimes it takes time for these things to reveal themselves to people close to loved ones, to friends, because sometimes what happens is a veteran will come back from combat, from being deployed and in combat, and may show signs of being delusional or may show signs of having flashbacks. Most of them consider this as something that is normal, because of course you just went through combat and now you're of course going to have nightmares and tremors and things of that nature. However, once you start noticing a difference in this person, I suggest you start speaking to them then. Try not to allow it to go months or years without confronting the issue. We cannot allow ourselves to be scared. Our loved ones' mental health is on the line. If you don't feel like you can say it to them, then I would suggest having another family member that they respect and admire, or a friend that they respect and admire, or another veteran that they respect and admire to speak to them about this, so that they can then get the help that they need. The course of PTSD is quite variable, as some symptoms may diminish rapidly while others may fluctuate in intensity throughout the individual's life. Approximately 30% of those who have PTSD develop a chronic form that persists throughout their lifetime. Now, and that explains exactly why it is important to be addressed right away. Don't diminish a lot of the signs. Speak on it, research it, and know what PTSD looks like in an individual. Several variables affect the likelihood that a trauma survivor will develop chronic PTSD, including severity of the trauma, duration of exposure, extent of being actively involved rather than a witness, dissociation at time of the trauma, pre-morbid psychiatric functioning, including exposure to prior trauma, extent of social support. So one of the things that I have noticed with my husband is that number 5, pre-morbid psychiatric functioning, including exposure to prior trauma. And one of the things, like, he'll talk about his childhood a lot and a lot of the trauma that he went through in childhood, and then going into military and being exposed to combat war in the military. All of this built up over years upon years, of course, makes an impact on any prior trauma, bringing it to the surface. And now that this combat has happened, now it's even more prevalent. So just like I said, watch out for the signs and be prepared to have the conversation. The Veterans Health Administration was the first institution to develop treatment programs for PTSD. Much needed treatment programs began to emerge in the mid 1970s in response to the clinical need seen among Vietnam veterans. So, yes, the VA has had treatment programs in place. A lot of times they don't speak about this to the I won't say the veteran, but the person, the guy, the man in active duty, um, because truthfully, they're not really told to speak about it. Um, they're not even told really to go to the VA to get benefits, because of course the money doesn't want to be spent or what have you. However, it is important for our guys, our girls to get treatment for this disease. It is just that a disease. It's called post-traumatic stress disorder. We can call it post-traumatic stress disease. Whichever you want to call it, it is what it is, and it needs to be addressed. If you don't want to go to VA, there are therapists and counselors that are licensed and practice and focus on PTSD, and some are virtual. And sooner enough, I'm in Bird Haven, will also have counselors that will be able to address this with them as well. It can be virtual or it can be in person. We're at this point where we're trying to meet them where they are or can be met, because not everyone can travel to the VA. The rates of comorbidity, the rates of comorbidity of PTSD and other psychiatric diagnoses are strictly high. If a person has PTSD, he or she is at a greater risk for also having another diagnosis. Like I said, my husband was diagnosed with extreme depression. And in one large study of individuals with PTSD, 92% met criteria for another Axis 1 disorder. More specifically, the following disorders were also present in the following rates: major depression, which I just mentioned, generalization anxiety disorder, alcohol abuse dependence. So you may notice that your veteran comes home and they're drinking more alcohol, or your guy or girl after he or she has been deployed, they come home and they're drinking more alcohol. Sometimes we accept this because we believe that this is what they did when they were overseas. 9 times out of 10, it has to do with the PTSD. It has to do with them not wanting to confront what happened while they were in combat, not wanting to think about, maybe someone who was close to them died, and they don't want to think about it. So they abuse alcohol. Speak on it, bring it to the forefront, and get help. Research specifically with veterans with PTSD has also documented quite high comorbidity rates regarding the global war on terrorism. One large study reported that 24 to 35% of soldiers admitted to using more alcohol than they meant to. So we can see how serious this is. Um, this particular session today is going to be shorter than the one I did last week. And the reason it is shorter is because I just want to make sure that we have a background and an understanding about PTSD, um, and the effects on the veteran, the effects on um, I don't want to say soldier, but the effects of our guy that is in service, that has been deployed, our guys and girls who have been deployed and coming back home, and then we wonder what's wrong with them. That is what's wrong with them. They have PTSD. They need to get it diagnosed. They deserve, especially our veterans, they deserve the benefits that they have access to. On our website, if you go to our resource page, hummingbirdhaven.org, you will see a resource guide there as you scroll down the page. And it has Cow Vet, and all of the resources that are available to veterans and family members. This weekend, we have the opportunity to provide food to a family that was in need. And the husband is a Marine veteran and the wife is an Air Force veteran. And to me, it's like seeing our veterans and their families suffering in need of food and in need of clothing or shelter or whatever it is, to me is a disservice to our military family as a whole, because our military family should not have to suffer that way. Like I say, and I'll say it again, they have served their country. It is now time for their country to serve them. So whatever you can do to encourage your veteran, your loved one, to be able to get the assistance that they need in order to, first of all, help themselves. And then second of all, provide for their family, be there to provide for their children. There's even service out here for, you can get stipend to go to college if your veteran is 100% disabled, or if you lost a spouse or you're a dependent of a veteran, and in need of education. There's a Chapter 13 in the GI Bill I'm sorry about that offers education. You can help pay for college, help pay for a trade school. We just have to take advantage of what's out here for our veterans. Yes, I recommend highly that our veteran suffering from PTSD, suffering from those signs of PTSD, go to the VA, get the necessary help needed, and go ahead and get your 100% disability. And just to understand that when you get 100% disability, you are not required to work. You can have a side business, but you do not have to work. And if you do work, they will then reduce your benefits. So I say take advantage of that. One of the things, my husband, he was not able to work because of the PTSD. And you may notice a lot of times that you're a veteran, male or female, when they get a job, dealing with PTSD, they're not able to focus, especially being in high-rise buildings. The first thing is, let's think about 911 when the planes crashed into the building. That thought of where's the emergency exit? How can I get out? They're always on a heightened alert. They're always combative. We spoke about that last time, about somebody being in line in front of them or cutting in line, and they might blow up as a normal person may just say, there's a line here, please get to the back. But they blow up a lot more easily than someone who's not dealing with PTSD. And yes, they have a hard time a lot of time with people in authority because, they're now having to deal with somebody else telling them what to do. And a person with PTSD, they're not receptive to that. So I will tell you this, it will benefit them to go get diagnosed. It will benefit them to get themselves up to 100%. If they do not get to 100% right away and they maybe get 30 or 60, I think my husband started off with 30%. I advocated for him and got him to 60%. And then there was someone else who stepped in, a lawyer or someone else, a therapist who's able to advocate for them as well. And he got up to 100%. So that's when now he doesn't work, he gets his benefits, and he works a side job. But the thing is, being able to recognize it, being able to get the therapy that the person needs, being able to get the benefits that they deserve through the VA, hospital, as well as therapy, as well as their benefits that they deserve. So if you have any questions, comments, concerns at any time regarding this topic on PTSD, please do not hesitate to comment or to inbox me in messages. I will be more than happy to reply. There's been a couple of people that have come on board to ask about DD-214s, that have asked about, what were the first steps that my husband took to get his benefits approved. And we're here to answer your questions. So, like I said, like us here on Facebook, visit our website at hummingbirdhaven.org, see what we offer. And like I said, we're forming, we're building, and we're looking forward to serving our veteran and family community. Thank you for listening in. And next week, we will talk about the effects of combat veterans, PTSD on relationships and families. We'll talk to you soon. Bye-bye.